Corruption is so bad in Nigeria that you cannot defend anybody and you cannot trust anybody.
Corruption is not about embezzling money. Selfish interest is also corruption. When you have a selfish interest against your nation, it's corruption.
That doesn't change the Nigerian in us. Are you hearing me?
They gave us cars. And when they gave us cars, I refused it. Otherwise, I won't get a house in Bodija Estate.
What's the problem with the Southerner becoming the chairman of Nigeria?
I don't know. We have problems.
My brother, your guess is as good as mine. I've always been asking this question.
Are you saying that government is not doing well in regards to the policy?
No, they are doing very well.
There's no way we can look at women and children issues without even looking at discussing with the men.
Tackles only on OSBC. Hello viewers, you're welcome to Tackles today on OSBC TV. My name is Deji Adefila. Today on the program, we're going to be talking about something that is very, very, serious in our society right now. We've been talking about this for some time, for close to some weeks now, and it's called Lassa fever. Lassa fever, is another disease that has come out in Nigeria since late 2015, and a lot of precautions have been taken right now. There have been a lot of sensitization programs on it.
Several families have been thrown into mourning as a result of untimely death of their loved ones arising from the deadly Lassa fever, which is caused by an infection with the Lassa virus spread by rats.
Oh yes. The rats that live in large numbers around us, they carry the virus in their urine and feces and live in the homes and areas where food is stored.
So, the ingestion of foods and drinks contaminated by the saliva, urine and feces of infected rats, catching and preparing infected rats as food, inhaling tiny particles in the air contaminated with infected rat urine or dropping, and direct contact with a sick person's blood or bodily fluids through the mucous membrane such as the eyes, the nose, the ears, or the mouth are ways of getting infected.
Early symptoms of the disease which occur within the first 3 weeks of coming in contact with the virus include fever, headache, chills, diarrhea, nausea, vomiting, sore throat, backache and joint pains. Late symptoms include bleeding from the eyes, the ears, the nose, bleeding from the mouth, rectum, the eye swelling, swelling of the genitals and rashes all over the body that often contains blood.
It could progress to coma, shock and eventually death.
Yes please. The good news however is that Lassa fever can be prevented. Oh yes, early detection and diagnosis greatly aids treatment, preventable death and curtails further spread of the virus. We should know, however, that preventing Lassa fever in the community is first about preventing the source, and that is why it's important to observe good personal hygiene by keeping our houses clean and the environment as well, so as to discourage rodents from entering our homes.
Some more measures that can be put in place is to avoid contact between rats and human beings by blocking out all rat hideouts. Options of fumigation can also be looked at for some bushy environments.
Absolutely. Please ensure you dispose your waste properly and clean the environment so that the rats are not attracted.
Store foodstuffs in rodent-proof and airtight containers.
And above all, also ensure you cook all foods thoroughly. Discard any food item that might have been contaminated in any form by rats.
Practice constant hand washing with soap and water. Promote a better personal hygiene.
And as soon as you suspect Lassa fever or you've persistent fever not responding to the standard treatment for malaria and typhoid, please kindly report to the nearest health facility.
Or call the following numbers.
Together, let us build a healthy nation.
Today on the program, I have someone who's going to be talking to us, a professional, especially in this field. I'm talking about Dr. OPALEYE. He's the head of department, Medical Microbiology and Parasitology, Lautech Teaching Hospital, College of Health Sciences here in Osogbo. How are you, Doc?
Thank you.
It's nice to have you on the show.
Yeah, welcome.
Well, to be an HOD in this department, I want to believe that anything called virus, you'll be able to probably help us out. Okay. And for people to know, this time around, we really are trying to get people safe. you know, knowing fully well that this thing is already in about 11 states in Nigeria, and especially we have it in Oyo State as well. So it's very close to us, and we can't just take chances over it. But, you know, all over it, looking at Lassa fever, I wanted to just give us a background check on this thing, you know, before we go ahead into what can be done and how can we prevent ourselves.
Thank you. Lassa fever is one of the virus or fever that are caused by viruses. Okay. It's actually an hemorrhagic fever. One of the hemorrhagic fevers as we have, because there are other hemorrhagic fevers too. Yeah. Hemorrhagic in the sense that they cause bleeding. So, of which Ebola also belongs. So, but Lassa fever was isolated or identified in Nigeria way back as 1969. Yeah. So, and since that time, the virus have moved to several West African countries, Sierra Leone, Liberia, and so many other countries like that have Lassa fever, endemic there. So the virus is caused, like I said, the fever is caused by Lassa virus, which is an RNA virus.
What's arenavirus?
When groups of viruses have families. Okay. So the family Arenaviridae, that is a family to which Lassa
belongs.
Yes.
Lassa is the name of a village.
Yes.
That time.
Yes.
When it was discovered.
Exactly. So it was in the taxonomy of viruses. Then they deem it fit to name it after that village. Because we also have Mokola virus. We also have Elisha virus and some other viruses that are named.
What's the virus in Elisha?
Well, it was a virus that was discovered in Elisha, so it was named after Elisha. Wow. So, and we have Kotonkan virus and so many other viruses like that. So, Lassa was one of them, so it was named after that village, Lassa. So, and it has been a problem all over in many of these West African countries, basically transmitted by rats, rodent actually. A particular species of rodent called Mastomys natalensis. So Mastomys species generally were able to transmit this Lassa virus that we're talking about, and it's transmitted by the excrement and of this rodent contaminating food material that we taking. So that's the basic way it's transmitted. However, there are also evidences that it could be transmitted via aerosols. It could be transmitted from man to man, especially from an infected person to another person. Okay,
so basically, this rodent, you know, this particular rodent, people have talked about it. Some say it's the normal MO that we see around. Some say that it's a little different, you know, and that he has about close to 24 breasts.
Yes, like that. yes. The rodent that transmits Lassa virus is a different rodent entirely. It's a multi-mammate rodent that is has multiple mammary glands. Okay. So if you have access to catching the female, you see that it has so many teeth, mammillary teeth, unlike the ones we do see around. However, you might not be able to distinguish which is a male, you know, Mastomys from a male other rodent. Okay. So, of course, it's Mastomys generally that transmit it, but you can identify or differentiate the female from other females. So that's just
is it both? Is it both the male and female that can transfer Lassa?
Yes, exactly.
Both of them.
Both of them.
Okay.
So that's why it's very important to guide against rodent generally, because you can never say which one is of Mastomys species.
Anyway, there's something that was raised on the floor of the Senate, and someone suggested that we should probably get all this, I don't know, these chemicals to kill rodents. You know, I don't know what's your view.
Yes. I won't buy totally to that idea, as much as it's important for us to keep away rodent from our houses, from our food, but we should not think of wiping away rodent entirely from the whole community, the environment, because we'll be disrupting the ecosystem in that way. Because the rodent takes care of some ants and takes care of, so those things that rodent feed on will get multiplied by the time we kill all rodents. And that will be another challenge for us. You know,
anyway, before we go into some of the things things that we can. I just remember that before we go into all of those things. You know, now that whenever this thing, you know, from their they excrete things, either their feces or their urines and things like that into what we eat. What are the signs that one will see if probably one gets to contact this? Well,
if one eats the contaminated food that has been contaminated by the urine and excrement of this rat, especially if the food is not properly cooked. Many of our food, perhaps, if we don't cook them, if we are talking about grains like gari or some other things that we don't cook, or perhaps in the process of cooking you've touched already, and peradventure you probably put it in your mouth. So that would be a huge danger. However, if such contaminated food are actually thoroughly cooked, the virus doesn't have the chances of surviving in such thoroughly cooked meat or food. Really? Yes. However, but like I said, you know, if it is it contaminates grain like rice, like beans, you have to take that grain from wherever you put it with your hand. And the process, after taking it with your hand, you use that hand to take the plate you use to serve or the pot. In the process, you use that hand to touch several other things. So, but really, it's the excrement that are contaminating either these formats or the food particularly that constitutes a challenge, you know, to us.
So basically, we can never, you know, talk enough about washing your hands regularly.
Exactly.
And you talked about cooking our food very well, you know. Are you saying that there is a degree, a level at which you can cook our food that even if this thing, if it has been contaminated, it can die?
Exactly. Okay. Most viruses cannot survive prolonged heat. And that's why most of them will thrive under some wet condition. So if thoroughly cooked at 100 degrees, whatever you are cooking, the virus will have died long ago before you even finish cooking. So, however, like I said, the chances are there that in the process of cooking, you've touched this, you know, food material and touched other things, and by that you can as well have disseminated, you know, the infection all around. So, and anybody taking such, using such will also get infected.
That's a chance. So. Okay, well, I want. There's something that that baffles me. The last time there was talk about Lassa fever, it was also in the dry season like this.
Yes.
Does it have anything to do with the dry season?
It's been found that it's seasonal, late in wet season and early dry season.
Why that?
Well, the reason we might not be able to totally ascertain, but like I said, some of these viruses might not be able to thrive, you know, throughout a particular period of heat, and that's why late in dry season, early wet season, perhaps that's when they come up.
Because what baffles me is that, you know, if they cannot really thrive under heat, and Lassa comes during dry season, you know, there is always heat.
Yes.
During dry season.
Yes. You remember that the Lassa virus is transmitted by the rat.
Yeah.
So it is the rat excrement, you know, perhaps that is left dried for so long that might not stand the chance of contaminating or making causing an infection. You know, but otherwise the seasonality, like I said, we have not really ascertained. Perhaps it's due to when the rats are more, or when the rat breed more, or when the rat, you know, it has to do with the rat in the recent.
Or it's possibly maybe some of those animals that usually don't come out during rains.
Exactly.
There are so many animals, you know, that actually, you know, go down, you know, during the rainy season, and at a particular season they come out. You know, there are so many on ground. Anyway, you know, after establishing, you know, what can cause this and how it can get into our environment, what are the ways? I mean, precautionary measures that we need to take.
Well, before the precautionary measures, one will have already. If somebody gets infected, the signs and symptoms will mimic fever, like it could be even similar to malaria fever, typhoid fever. But when such fever has been treated for days and the fever has not, you know, abated, then there should be some query. Perhaps it could be Lassa fever. So that's very important. It has other associated signs like sore throat, like diarrhea.
It's something close to Ebola virus.
Well, it's close, but it's not as severe as Ebola. That's the only good thing about it. And it's also treatable. unlike Ebola. There is a drug called ribavirin that is used for treatment of.
If it is discovered early.
Exactly.
Like how many days, can one carry this thing on the system before, danger?
The incubation period between the time of contact and the manifestation of symptoms is between 5 to 21 days.
Okay.
So after the 21st day, if such signs are noticed and within the first week or thereabout, treatment is commenced, of course, the fellow stand the chances of recovering uneventfully, that is without much coming down, having to be on the bed for so long and stuff like that. However, the chances are still there that this virus could be voided in the excrement of the infected person, in the semen, and also in the blood. So, because the virus will take its time to multiply and will get out of the fellow also through this waste. So, protected sex is also very important when we talk of somebody infected, even though he has recovered after treatment. So, till the virus is, we are sure that the virus is no more in the system. Yeah.
So I was there were suggestions that some of the things that we can do to probably guide against this particular rodent. Someone mentioned, issue of having cats at home. Well, I don't have problem with having cats. I know a lot of people breed cats at home.
Yeah.
But my question is, if a cat gets to kill this particular rodent, can't the cat transmit it?
Well, no, the cat cannot transmit it because it has not been established that the virus can thrive in cat. So the rodent still remains the reservoir of this, or the carrier of this virus or viral infection.
Someone has mentioned bats as well.
Well, that has not been established as well. But for now, it's only rodents that we know, and transmission by inhalation too, perhaps if there is an aerosolized excrement of these animals, or from the fellow infected, perhaps that fellow sneezes or coughs, because the virus is already in a system, and many of it, so it could get other people infected. So that's why people that are taking care of people infected should wear masks and stuff like that.
Then now that we already know about those things, what's your advice? Probably for health practitioners, that will probably be looking after them. What are the measures? What should they do?
For health practitioners, it's important that they take preventive measures, like wearing gloves, gown, protective mask, while attending to this patient. And it's been found that there could be nosocomial infection, that is infection from an hospitalized person to somebody treating him, and from that person to other patient also. So to guide against this, there should be good hygiene also, apart from these protective wears that are necessary while taking care of such people infected.
Okay, then someone mentioned that if probably one do not have a very strong immunity, that there is a chance for a person to even die even before 21 days of incubation of this thing. How possible is that? Well,
that is still under suspicion. Maybe that is possible, because it's been found that most infections that immunosuppress could actually make someone die within some minutes if the immunity is not good and stuff like that. So if somebody having HIV, for instance, has Lassa fever, the risk is much higher in that person because his immune is suppressed already. So if he starts stooling or vomiting, then the chances of his survival is slimmer than somebody that is much healthier. So, but that he could kill within hours, well, I'm not too sure.
Okay, yeah, so Dr. OPALEYE, what are the other things, what are the other areas that you think we should consider? Because we're trying to educate people, to sensitize them, so that everybody can be on alert, in just in case anything. We're not praying that it comes around here, but we never can say. Anybody that has Lassa fever can travel from another state. Like what happened, in Abuja. The victim actually traveled from Jos.
Even in Lagos.
To Abuja, in Lagos,
So, well, basically what we could do is to guide against rats with our food, and that's keep your food, in a rat-proof, secured places, so that rats don't get access to them. And if there are rats around, like we said, we could make use of cats. There's nothing wrong with that. As much as possible, yes, fumigation and all that, that is also necessary. And if somebody has a suspected case of Lassa, by virtue of the fact that the fellow has fever for more than 2, 3, 4, 5 days after treatment, this fever still persists, then such a person should be taken to the hospital, and of course adequate treatment should be given. Because it's a treatable disease, fortunately, unlike Ebola that we have to battle with for so long to get something to treat, there's a ready available drug that could take care of this viral infection. Okay,
you work here in Osun State, and being a doctor, and especially the HOD of a particular, this department, what are the measures, what are the things that you have on ground, just in case we have an outbreak or something? Well, we pray we don't have an outbreak, because ordinarily prevention, they say, is better than cure, and it's often more costly. We must keep our guards. Most costly, yes. We must keep our guards. Thank God we have not had any such case in Osun State as yet. But if they are, like the case that was reported in Lagos, the fellow was taken to a private hospital, and the fever he had persisted for more than 6 days, even with treatment, and then they have to refer him to Lut. And our hospital system, well, it's unfortunate we don't know what is happening now with the tertiary health system in the state, but our hospital system should be well equipped to actually be able to take care of such patients. It's not something they can handle in a private clinic, so our tertiary hospital should be well equipped to handle such challenges. Okay, well, viewers at home, I've been speaking with Dr. OPALEYE. He's the head of department, medical microbiology and parasitology, College of Health Sciences, LAUTECH in Osogbo. And he has been speaking to us on what we need to do and the things you will probably notice if anyone has a contact with Ebola. With Lassa virus. Well, I must say this at this point in time that it is never enough for us to have a clean environment. You need to have a clean environment. You need to wash your hands regularly, even when you are taking your pots, your plates, your spoon are fresh from wherever you keep them. You must make sure you rinse and rewash them every time. You never know if any cat has come in and has a contact with all of these things. And just like you mentioned, there is need for us to also try as much as possible to have rat-proof, containers where you can put your food items, your gari, your rice, your beans, your powdered things, all those things. There is need for us to keep them, away from rats. And everything that you can possibly do. Someone has suggested the issue of using traps, for all these cats, because we have to guide against using chemicals to also kill them as well, because even if a rat takes a chemical and get across your food, it could also be dangerous to the health of anyone around us. We are praying that nothing of such actually comes around us, but there is need for us to do what is necessary, because just like doctor said, prevention is better than cure. Dr. OPALEYE, I must say thank you so much for coming on the program today. You're welcome. Well, that was tacos for you again. Until next time when we shall be here again on this show. My name is Deji Adefila. Have a good evening. God bless you.
Measures that can be put in place is to avoid contact between rats and human beings by blocking out all rat hideouts. Options of fumigation can also be looked at for some bushy environments.
Absolutely. Please ensure you dispose your waste properly and clean the environment so that the rats are not attracted.
Store foodstuffs in rodent-proof and airtight containers.
And above all, also ensure you cook all foods thoroughly. Discard any food item that might have been contaminated in any form by rats.
Practice constant hand washing with soap and water. Promote a better personal hygiene.
And as soon as you suspect Lassa fever or you've persistent fever not responding to the standard treatment for malaria and typhoid, please kindly report to the nearest health facility.
Or call the following numbers.
Together, let us build a healthy nation.